At 3 a.m., a remote monitoring machine quietly hums in a dark living room. It tracks a patient's vitals with total precision. The data is perfect and the room is silent. This was the world Kathy Tarochione lived in. At 79, managing COPD and congestive heart failure, she relied on 24-hour oxygen. Her only constant companions were her 19-year-old dog Charlie and a stuffed animal named Tark, a namesake of her late husband. Her doctor looked her the heart and told her it was time to get her affairs in order. While the healthcare system could read a dip in her vitals at any hour, it had no way to see that Kathy, as a person, felt she was disappearing. Hospital-at-home programs successfully move remote monitoring and telehealth into the bedroom. They provide the clinical tools for recovery, but they often struggle to provide a patient with a reason to wake up in the morning. As this document highlights, the most frequent reason these home care admissions fail is a loss of will. When a caregiver loses confidence or panics at 2 a.m., it frequently triggers an avoidable transfer back to the emergency room. Clinical infrastructure is designed to keep a body alive, but it takes emotional support to sustain the will to live. After surviving the ICU, Kathy faced the exhaustion of long COVID, significant hair loss, and the weight of total isolation. She spent weeks avoiding her reflection. Finally, she forced herself to stand in front of a full-length mirror and look directly at what the illness had done. She chose to embrace the body that had carried her for 77 years and commanded her mind to take control. She called this practice the strength mirror. Working from her recliner while on oxygen, she developed over 40 specific mental strength techniques based on this initial mirror practice. These intentional daily mental exercises are what built her resilience. Golden in Motion bridges the gap between clinical monitoring and human isolation. One pillar, Living Memoirs, uses an AI twin to record stories, ensuring identity remains intact. The system also includes the Golden Hug Protocol, a 20-second embrace addressing touch starvation. Through golden spaces, the system transforms physical and digital environments into places where patients can build community rather than just aging in isolation. This approach operationalizes empathy, turning a medical sentence into a movement of growing in motion. Kathy went from a candidate for silent deterioration to the architect of an AI legacy system and a housing development. Maintaining emotional engagement leads to concrete results. It reduces preventable hospital readmissions and lowers caregiver dropout rates. Current predictive models can observe a patient's decline, but they lack the tools to intervene and prevent the isolation that causes it. Without a way to manage human engagement, even the most advanced clinical infrastructure can fail at the finish line. Every patient returning home is a person with a story that is still being written, and they deserve care that recognizes their identity alongside their vitals. Patients and families should ask their providers for specific tools that address isolation, purpose, and caregiver support. The Golden Life community coordinates these tools by connecting healthcare systems, AI partners, and senior living networks. Their mission is to build the emotional infrastructure required for human dignity. Kathy Tarochione's work is a testament to human endurance, defined by her personal refusal to drown or go down. That is the resilience this technology aims to scale for everyone.